Good afternoon. Today we're going to talk about human reproduction and the biological process that make pregnancy possible. In this presentation, we will explain the anatomy of the male and female reproduction system, the menstrual cycle, fertilization, embryonic development, pregnancy, and childbirth.
Understanding this process is important because reproduction is not only process but also a complex process regulated by hormones, physiology, and human development.
Sexual education is not limited to biological reproduction. It involves several important dimensions of human development.
The first dimension is the biological pillar, which includes anatomy, physiology, and reproductive mechanisms.
The second is the emotional pillar, which involves meaning, emotions, relationship, and personal boundaries.
The social pillar focuses on how society influences sexually, including genders, roles, and social expectations.
Finally, the ethical pillar emphasis respect, responsibility, and informed decision making.
The male reproductive system is responsible for producing and transporting sperm cells.
The testes located in the scrotum produce sperm through a process called spermatogenesis.
Sperm cells then move to the epidermis where they mature and gain motility.
After that, they travel through the vas deferens, which transport them toward the pelvic cavity.
During ejaculation, accessory glands such as the seminal vesicles, prostate, and, and bulboretal glands produce seminal fluid that nourishes the protects the sperm.
The testes have two main functions: gamete production and hormone secretion.
The first function is the spermatogenesis, which occurs inside the seminiferous tubules.
The second function is endocrine. The testes produce testosterone, an hormone responsible for male sexual development and, and regulation of sperm production.
The female reproductive system produces ova and support fetal development during the pregnancy.
The ovaries produce oxytocin and hormones such as estrogen and progesterone.
The fallopian tubes connect the ovaries to the uterus and are usually to place where fertilization occurs.
The uterus is a muscular organ that supports implantation and fetal development.
Finally, the vagina connects the uterus to the external environment and plays a role in the intercourse, menstruation, and childbirth.
Females are born with a limited number of oocytes known as the ovarian reserve.
At birth, the ovaries contain hundreds of 2000 of primordial follicles, but only a small number will mature during reproductive life.
During each cycle, several follicles developing, but usually only one becomes dominant and releases the ovum during ovulation.
After ovulation, the follicle becomes the corpus luteum, which produces progesterone.
The menstrual cycle lasts on average 28 days, although normal cycles can range from 21 to 35 days.
It is controlled by the hypothalamus pituitary gland and ovaries, which together form the hypothalamic pituitary ovarian axis.
The main goal of this cycle is to prepare the uterus for for the possible pregnancy.
Hormones regulate the menstrual cycle.
Estrogen increases during the first half of the cycle and stimulates the growth of the endometrium.
A surgery in LH triggers ovulation.
After ovulation, the corpus luteum produces progesterone, which prepares the uterus for implantation.
The cycle begins with the menstruation when the uterine lining is shed if fertilization does not occur.
After menstruation, the follicular phase begins. During this phase, FSH stimulates follicle development.
As follicles grow, a stronger level increase and the endometrium takes.
Around day 14, ovulation occurs and the ovary release the oocyte.
After ovulation, the luteal phase begins and the corpus luteum secretes progesterone.
This hormone stabilizes the endometrium and prepares it for a possible embryo implantation.
Several factors can disrupt the menstrual cycle.
For example, metabolic stress, extreme exercise, or weight loss can stop the cycle.
Psychological stress may also affect hormone regulation.
Another condition is polycystic ovary syndrome, which interferes with ovulation.
Fertilization occurs when a sperm cell joins an oocyte, forming a zygote.
The zygote begins dividing through mitosis while moving towards the uterus.
By day 3, it forms a morula, and by day 5, it becomes a blastocyst.
Around day 7, the blastocyst implants into the uterine lining.
Pregnancy lasts approximately 40 weeks and is divided into 3 trimesters.
In the first trimester, the major organ begins to develop.
In the second trimester, the fetus grows rapidly and begins to move.
In the third trimester, the fetus gains weight and prepares for birth.
Childbirth occurs in 3 stages.
The first stage is dilatation when the cervix opens.
The second stage is expulsion when the baby is delivered.
The final stage is delivery of the placenta, which completes the birth process.
Thank you very much for your attention.
Now we're gonna present case number 1, which is polycystic ovary syndrome, also known as PCOS. In this case, we have a 28-year-old woman who visits the doctor because she has irregular menstrual periods. She has also experienced recent weight gain and difficulty getting pregnant.
Based on of these symptoms, the doctor supposed polycystic ovary syndrome, which is a hormonal disorder that affects the ovaries. In PCOS, the ovaries produce higher levels of male hormones called androgens, which interfere with normal ovulation. Because ovulation does not occur regularly, women may experience irregular menstrual cycles and fertility problems.
To confirm the diagnosis, doctors usually perform a medical history evaluation, physical examination, blood tests to measure hormonal levels, and ultrasound imaging of the ovaries. Treatments depends on the patient's symptoms and goals. It may include lifestyles changes such as weight management, hormonal medications to regulate the menstrual cycle, and treatments that simulate ovulation if the patient wants to become pregnant. Thank you.
And about the opinion of the video, in my opinion, having a shield is very important decision that people should discuss calmly and carefully. It's not something that should be decided quickly because raising a shield brings many responsibilities in the future. Parents need to think about their time, their financial stability, and their ability to give love, education, and support. For that reason, it is important to talk about it seriously before making the decision.
And I believe that deciding to have a child is something that requires a lot of thought and communication between parents, because this is important to talk calmly about the future, because having a child will change many aspects of your life. There will be new responsibilities, challenges, and commitments. That is why couples should think carefully about their plans, their goals, and whatever they are ready to take care of a child together. Thank you.